Good day, learners. I'm Ray Gapus. I'm a test preparations coach for the last 25 years, and I've been doing coaching classes for NCLEX RN, both here in the Philippines and internationally. I'm also an author of two test preparations guidebooks for the NCLEX RN, which are internationally published. My Western and my Eastern education has enabled me to come up with guidelines, which I call functional concepts. And these concepts are the ones that are helping nurses to deconstruct questions on the NCLEX RN. So I'd like to share with you some of these functional concepts as we engage in our learning sessions today. Good day, learners. We're now moving on to lesson number 41. If you would ask me, what would I study in preparation for the NCLEX RN? Then one of the topics that I'd like to highlight would be the assessment of cranial nerves.
I've gotta do, so I'm not crying.
Now, today we're going to talk about how to study the 12 cranial nerves such that we would be able to empower ourselves to be able to answer questions related to this concept. So let's learn together. If you have some more interest in learning with me, okay, so for more instructional videos, kindly subscribe to my YouTube channel, Gapus Mentors. Don't forget to hit the bell button so that you'll get notifications when I upload my new videos, and my Facebook page, Mentor Ray. Okay, learners, let's start this discussion with a question: which cranial nerves make a woman happy? So this is sort of like an intriguing question that we need to come up with an answer towards the end of our discussion. So I just hope you watch the entire video so you'll get the answer to this question which we are posting right now. Now, if I'm going to study the assessment of the 12 cranial nerves, I would definitely break it down such that it becomes more chewable. So I will begin breaking down the concept in terms of the classification of the cranial nerves. So we all know for a fact that out of the 12 cranial nerves, there are 3 sensory cranial nerves, namely olfactory nerve, the optic nerve, and the vestibulocochlear nerve. So this is our first functional concept. Remember, functional concepts are, it could either be in the form of a word, a phrase, a sentence that serves as a guide to help you deconstruct questions on the NCLEX RN. In essence, it serves as your guide. So let's begin with a sample question. Knowing that there are only 3 sensory cranial nerves, we can already use that knowledge from that functional concept to answer a question. So here's a sample question. Which of the following cranial nerves are classified as sensory nerves? Select all that apply. We just said that we have 3 cranial nerves that are considered as sensory nerves, and those are cranial nerves 1, 2, and 8. So we put a check on olfactory, a check on optic nerve, put an X on oculomotor, a check on vestibulocochlear nerve because we've learned that. And since we all have already identified 3, and then it's actually logical to put an X on the next 2. And those are your cranial nerves, trochlear and abducens. Options 5 and 6. So the correct answers are, the sensory nerves are cranial nerves 1, 2, and 8. Olfactory, optic, and vestibulocochlear nerves. Now, the next functional concept would be each of the 3 sensory nerves have specific functions. So let's figure things out. For the olfactory nerve, the function is primarily for the sense of smell. Now, the next question is, how do we assess the sense of smell? So we actually ask the client to smell either coffee or lemon peel, and then we note for abnormalities. Now, how would you know that there are certain abnormalities? So the first abnormality would be anosmia, or the loss of sense of smell, which is kind of dangerous because when there's a gas leak inside the house, the patient would not be able to smell it. The second abnormality would be parosmia, or the inability to identify odors or natural smell. So in other words, the patient may not be able to detect others, or there could be distortion on how they perceive others. Next, let's move on. For cranial nerve 2, you have the optic nerve. Now, the function of the optic nerve is actually for the sense of sight or vision. Now, how do we assess cranial nerve 2? We assess cranial nerve 2 by focusing on 5 areas. And the first one is actually assessing visual acuity. And to do so, we need your Snellen charts. Okay, so what do we ask the patient? We ask the patient to either sit or stand 6 meters or 20 feet from the chart. And then we ask the patient to cover one eye and read the letters from the biggest to the smallest. And then that's also done on the other eye until such a time that the patient may experience difficulty, and that has to be communicated to the healthcare provider. And then we also need to assess the patient's ability to discriminate color using the Ishihara plates. Now, this is actually intended to assess the presence of color blindness in the patient. And within each plate, we usually have a pattern that are colored differently from the rest of what you have on the plates. And the dotted colored patterns are actually either in the form of a shape or a number. Now, if the patient is unable the numbers or the shape that's contained in the plate, then that may potentially indicate color blindness. And then we also need to assess the patient's visual fields. And to do so, we ask the patient to position himself or herself face-to-face with the healthcare provider. And then we spread our arms and wiggle our fingers. And then we ask the patient to identify which finger is moving. Okay, and then after that, we need to assess for visual reflexes. And this is done by placing one hand vertically along the nose. And then we use a pen light and turn on the light on one side, making sure that the light doesn't pass through the hands. And then we check if both of the eyes will react by constricting simultaneously. Okay, and last but not the least, we need also to perform fundoscopy or ophthalmoscopy, which involves the visualization of the retina. Now, this assessment method would actually enable us to determine if the patient would have conditions like hypertension or diabetes. Now, what sort of abnormalities could be noted when we are assessing cranial nerve 2 or the optic nerve? So we have homonymous hemianopsia, in which there's a loss of visual field on half of the eyes, which means the patient could only see either on the right half of each eye or on the left half of each eye. So how would you know that the patient's having homonymous hemianopsia? More frequently, this is manifested by the patient when they are unable to see and eat the food on their plate entirely. So such that they only consume half of the plate, of the food on their plate. It's because their sense of sight is impaired on the other half. That's the reason why for this type of conditions or abnormalities, the patient is usually given a nursing diagnosis of unilateral neglect. That is, they are unable to see half of the visual field. Okay. Now, another abnormality that we need to assess the patient for would be optic neuritis, which is usually the inflammation of the optic nerve, and that could potentially also lead to vision loss. Now, the eighth cranial nerve, the third of the three sensory nerves, is actually your vestibulocochlear nerve. Now, of course, the main function of this nerve would be to assess one's sense of balance. The caloric stimulation test is usually performed. Now, this test involves the instillation of alternating cold or warm water or air into the ears. So, it detects damage to the acoustic nerve. Now, how would we know that the test is positive? The test is considered positive if there's nystagmus, or the involuntary movement of the eye. Now, if there is moderate nystagmus, that usually potentially indicates Meniere's disease, which is due to the imbalance in the endolymphatic fluids in the patient's inner ear. Now, what about if a patient has an absence of nystagmus? Now, this could potentially indicate acoustic neuroma. Now, when a patient has acoustic neuroma, this is actually the presence of a non-cancerous tumor in the patient's vestibulocochlear nerve. Now, the common manifestation of acoustic neuroma would usually involve ringing sounds in the ears or tinnitus, and then this would progress eventually to hearing loss. And then the patient may exhibit difficulty maintaining balance, so they become clumsy, they experience headache and facial tingling. Now, eventually, the patient may also experience vertigo or a sensation that the room is spinning or rotating or revolving. So it's very important for these patients experiencing vertigo to be positioned flat so that they don't risk falling. Now, your acoustic neuroma is usually diagnosed through magnetic resonance imaging or MRI. Now, when a patient has undergone caloric stimulation tests and water is used, it has to be drained after the test. Your vestibulocochlear nerve is also responsible for the sense of hearing. Therefore, when we assess the patient, we could actually do Rinne test. Now, your Rinne test involves using a tuning fork and actually sending it to vibration, placing it on the mastoid bone of the patient, and then after that, near the auditory canal. Your Rinne test detects conductive hearing loss, and this is carried out by comparing air conduction and bone conduction of sound. On the other hand, the Weber test could also be done. Now, your Weber test can detect both sensory neural and conductive hearing loss. So it also involves the use of a tuning fork that is usually placed on the patient's head. And then you ask the patient in which ear the patient is able to hear the sound better. So if the sound is louder in one ear, which is the affected ear, then the patient would more likely have conductive hearing loss. Now, however, on the other hand, if the sound is heard better in the normal ear, then the patient is having sensory neural hearing loss. So your Rinne test or Weber test could actually give information if the patient is suffering from deafness.
You won't get away.
Now, let's try to apply what we just have learned by answering a sample question. So, which of the following statements is made by a patient are associated with abnormalities of the vestibulocochlear nerve or cranial nerve 8? Select all that apply. Option 1, I feel as if I am spinning. Now, this usually indicates vertigo, so it is indicative of an abnormality of cranial nerve 8, so we put a check. Option 2, I'm having difficulty hearing. So once again, this is indicative of deafness, so we put a check. Then I have ringing in my ears. This indicates tinnitus. So once again, we put a check because that's an abnormality of cranial nerve 8. And then I don't smell anything. Now, this indicates anosmia, which is actually an abnormality of the olfactory nerve, not the vestibulocochlear nerve. So we put an X. And then option 5, my husband asked me if my eating just on one side of my plate is my way of dieting. Now, this indicates homonymous hemianopsia, which is an abnormality of optic nerve and not of the vestibulocochlear nerve. So we put also an X. So the correct answers are options 1, 2, and 3. Now let's move on to the next functional concept. There are 5 motor nerves, namely oculomotor, trochlear, abducens, spinal accessory, and hypoglossal nerves. So we have cranial nerves 3, 4, 6, 11, and 12. And I have a mnemonic. It's OTASH, oculomotor, trochlear, abducens, spinal accessory, and hypoglossal nerve. Okay, each of the 5 motor nerves have specific functions. Let's pay particular attention to cranial nerves 3, 4, and 6. These cranial nerves, as a group, are responsible for eye movements, specifically ocular and extraocular eye movements, as well as pupillary response. We have to know that when you look upwards, okay, that's a function of your oculomotor nerve. When you look down and inwards, that's a function of your trochlear nerve. And when you look outward, that's a function of your abducens nerve. Now, how do we assess your cranial nerves 3, 4, and 6? First, we ask a patient to look straight and then focus on a target, and then we move the target in an etch-like pattern, and then we ask the patient to actually follow the target. And then we also assess for accommodation reflex. So accommodation and convergence reflex is usually done by asking the patient to focus on a near object, and then you move it farther and then focus on, or you do the reverse. If you ask the patient to focus on a distant object and then move it towards the eyes. We also need to assess the pupillary light reflex. This is done by first dimming the room and then using a pen light and directing it straight into one eye. So we will observe that the pupil constricts with light exposure. Okay, now after we've learned how to assess your cranial nerves 3, 4, and 6, it's very important that we take note of the abnormalities that could result. So the first one is diplopia or double vision, ptosis or drooping of the eyelids, nystagmus or the jerky movement of the eyes. Strabismus occurs when the eyes are not properly aligned. In essence, it points to different directions. And then mydriasis, or the dilatation of the pupils, or the pupils do not respond to light stimulation. And this could actually be associated with what is called third cranial nerve palsy. The next functional concept. Let's focus on the functions of cranial nerve number 11, your spinal accessory nerve. So spinal accessory nerve is responsible for shoulder movement. And then assessment would usually involve asking the patient to shrug their shoulders or to turn the head from side to side. Okay, muscle weakness indicates an abnormality of this cranial nerve. And then cranial nerve number 12, the fifth of the 5 motor nerves, functions for tongue movement. And to assess whether this is intact or not, we ask the patient to stick out the tongue and then move the tongue and note for fasciculations or weakness on one side. And weakness of tongue movement is indicative of an abnormality. Okay, let's apply what we just learned in answering questions. Which of the following cranial nerves are classified as motor nerves? So oculomotor, we put a check. Optic, no, because that's a sensory nerve. Trochlear, yes, that's a motor nerve. Abducens, that's a motor nerve. Olfactory, no, that's a sensory nerve. Spinal accessory, yes, that's a motor nerve. And hypoglossal, yes, that's a motor nerve. So the correct answers are 1, 3, 4, and 6, and 7. So those are the options that are correct. Now, let's pay particular attention to another type of question. This time it's focusing on the abnormality associated with cranial nerves. So here's a sample question. Diplopia or double vision results from damage to which of the following cranial nerves? Select all that apply. So we know for a fact that diplopia is actually associated with abnormalities of cranial nerves 3, 4, and 6. So let's figure things out. So 1, oculomotor. Yes, that's cranial nerve 3. Optic, no. Put an X. Trochlear, yes, that's cranial nerve 4. Facial, no, that's cranial nerve 7. And abducens, yes, that's cranial nerve 6. So the correct options are 1, 3, and 5. Now, the last classification of cranial nerves would usually involve 4 sensory motor nerves, namely trigeminal, facial, glossopharyngeal, and vagus nerves. So these are cranial nerves 5, 7, 9, and 10, respectively. So let's figure things out. Option 1, facial. So we put a check. Yes, that's a sensory motor nerve. Trigeminal. Yes, that's a sensory motor nerve. Oculomotor. No, that's a motor nerve. Vagus. Yes, that's a sensory motor nerve. Glossopharyngeal. Yes, that's a sensory motor nerve. And abducens, that's just a motor nerve. So in other words, the correct answers are options 1, 2, 4, and 5. Now, let's figure out the functions of each of the 4 sensory motor nerves and identify methods of assessing these nerves as well as associated abnormalities. So let's begin with cranial nerve 5, trigeminal nerve. So as we all know, it has both sensory and motor function. The sensory function involves sensation on the face, so facial sensation, and the motor function involves mastication or chewing. So how do we assess the sensory root? We use a pin or cotton ball and then usually run those through on the cheek, on the forehead, and on the chin, and ask the patient if they feel something. Then we also need to assess the corneal reflex, okay? Now, how do we assess the corneal reflex? We need to use a piece of cotton and lightly touch the cornea with the cotton. What is usually an expected reaction from the patient would usually shut their eyelids, okay? The associated abnormality for cranial nerve 5 would be trigeminal neuralgia. Now, trigeminal neuralgia is a condition characterized by chronic pain, and it is usually caused by a tumor that is exerting pressure on the trigeminal nerve. That's the reason why there's usually chronic pain. Now, for the assessment of the motor root of the trigeminal nerve, we ask the patient to clench the teeth, okay? And then we also need to assess the jaw jerk reflex. Now, how is this done? So we need to face the patient. We place index finger against the chin of the patient, and then we hit it with a tendon hammer. So we hit the finger with the tendon hammer, and then the result would be the jaw of the patient would slightly protrude, okay? And that's its expected. Next, the second of the 4 sensory motor nerves involves your facial nerve. So the sensory root is responsible for the sense of taste for the anterior 2/3 of the tongue, and then the motor root is responsible for the movement of facial muscles. Now, how do we assess the sensory root of the facial nerve? First, we use a cotton swab soaked in different solutions. And then we use those soaked cotton swab to introduce taste that the patient needs to identify. But we have to be careful that we ask the patient to gargle in between testing of the taste. So we could either soak the swab on sugar water and then swab it on the anterior lateral side of the tongue, and then ask the patient to identify it. And we ask the patient to gargle, and then we soak the swab again in salt water this time, and then we apply it on the lateral side of the tongue, and we ask the patient again to identify it. And then after that, we ask the patient to gargle once again. Now, a common abnormality for the sensory root of the facial nerve is a condition known as ageusia, or the complete lack of sense of taste. We also have the condition known as hypogeusia, or a decrease in the sensitivity to taste. And we also have dysgeusia, or the distortion of taste. Now, dysgeusia could be associated with treatments like chemotherapy and the use of albuterol. So albuterol could potentially alter the patient's sense of taste. Now, let's move on to the motor root of the facial nerve. To assess the motor root of the facial nerve, we need to ask the patient to move the facial muscles. Now, how is that done? We first have to ask the patient to crease up the forehead or keep the eyes closed against resistance. And then we ask them to puff out the cheeks and, of course, to reveal the teeth. And we can always ask them to smile to do that. Okay? Now what condition would usually tell us that there's an abnormality of the motor root of the facial nerve? So we have a condition known as Bell's palsy. Now, Bell's palsy is characterized by a weakness of one side of the face, and usually this is temporary, and it could be related to either an inflammation or a compression of the facial nerve. This could actually affect patients from age 16 to 60 or at any age within those range. So the good thing is that this is reversible. Now, the third of the 4 sensory motor nerves, so the glossopharyngeal nerve, which is responsible for the sense of taste for the posterior 1/3 of the tongue. Now, how do we assess it? Once again, we assess it like the way how we did it with the sensory root of the facial nerve. So again, we make use of swab and soak it in different solutions, like to assess for the ability of the patient to discriminate bitter taste, we can use coffee solution, and to assess the patient's ability to discriminate sour taste, then we can use lemon solution. And if there's a loss of taste sensation to the posterior 1/3 of the tongue, that's considered an abnormality. Now, the motor root of the glossopharyngeal nerve is responsible for swallowing, and this is usually tested together with the vagus nerve. So we use a tongue depressor, ask the patient to open the mouth and say ah, or we ask the patient to swallow or cough. If there's a failure of the gag reflex, that's an abnormality of the glossopharyngeal nerve. Now, difficulty in swallowing or dysphagia is also a manifestation of abnormality of the glossopharyngeal nerve. The last of the 4 sensory motor nerves is your vagus nerve. It also has sensory roots which function to decrease the blood pressure or the heart rate. And therefore, once stimulated, we need to check the vital signs. An abnormality would be when there's increased blood pressure or heart rate. And since the recurrent laryngeal nerve actually divides from the vagus nerve, so affectation of the recurrent laryngeal nerve could actually cause hoarseness. So if a patient has hoarseness, it's the vagus nerve that could be affected. So the motor root of the vagus nerve is actually responsible for the muscles for swallowing and speech. Now, assessment would be just like that of your glossopharyngeal nerve. We actually elicit the gag reflex using a tongue depressor, and we note for swallowing difficulty and the failure of the gag reflex. Okay, now let's use the knowledge we just learned to answer a question. Here's a sample question. Hoarseness results from damage to which of the following cranial nerves? Is it 1, oculomotor, option 2, the optic nerve, option 3, the facial nerve, and option 4, the vagus nerve? Now, we've learned a while back that hoarseness could be associated with the affectation of the recurrent laryngeal nerve, which divides from the vagus nerve. So the answer is option 4, the vagus nerve. Now let's highlight. I know for a fact that after going through all those 12 cranial nerves, sometimes we kind of mix up things and it's difficult for us to recall some similarities in terms of the functions of these cranial nerves. So let me highlight some of these things. Now, let's differentiate cranial nerves 5 and 7. So both are sensory motor nerves. Let's take a look at cranial nerve 5. The sensory root is responsible for facial sensation. It's assessed using a pin or a cotton ball. And the motor root is actually responsible for chewing, and it's assessed by asking the patient to clench the teeth. For cranial nerve 7, it's also sensory motor, so it's a mixed nerve. So the sensory root is responsible for a sense of taste. It is assessed using solutions with flavor, different ones. And then the motor root is responsible for facial movement. So it's assessed by asking the patient to smile or to reveal the teeth. So if we ask the patient to clench the teeth, we're assessing trigeminal nerve or cranial nerve 5. If we ask the patient to reveal the teeth, we're assessing cranial nerve 7 or the facial nerve. Now, let's also differentiate glossopharyngeal nerve, which is cranial nerve 9, and the hypoglossal nerve, which is cranial nerve 12. So the main difference lies in the fact that cranial nerve 9 is a mixed nerve. It has both a sensory and motor root. The sensory root is responsible for the sense of taste in the posterior 1/3 of the tongue, and the motor root is responsible for swallowing. On the other hand, cranial nerve 12 or hypoglossal nerve is a motor nerve, and it's just responsible for tongue movement. So it's being assessed by sticking the tongue out. Okay? Let's move on to a functional concept. The sense of taste is related to the functions of the following cranial nerves: the facial nerve, the glossopharyngeal nerve, and the vagus nerve. Now remember, the vagus nerve has a special sensory function as it provides taste sensation behind the tongue. For the anterior 2/3 of the tongue, the taste sensation is actually related to the function of the facial nerve. For the posterior 1/3 of the tongue, it is actually the function of your glossopharyngeal nerve. Now, let's go back to the question that we posted at the beginning of our lesson. Which cranial nerves make a woman happy? Do you have something in mind? I know this question brings a smile on your face, but sometimes sorry to disappoint you with whatever answer you have in mind. But the answers are the optic nerve, the oculomotor nerve, the trochlear, and the abducens nerves. Okay? So that's cranial nerve 2, 3, 4, and 6. Why? Most women put a lot of efforts into the way how they look. So as you look at the women as they pass you by, that's one form of admiring them. And that's an important thing to do to a woman. So once again, it's shout out time. Congratulations to a lady from Tarlac City, Joy Añasco, USRN, for passing the NCLEX RN for the state of Texas. Once again, congratulations from your RA Gapos family. So let's learn together. For more instructional videos, subscribe to my YouTube channel, Gapos Mentors, and my Facebook page, Mentor Ray. If you have anything in mind that you want me to cover in my future videos, or if you're confused with some concepts and you want clarifications, please feel free to send me a note or a message through my email, mentor.raygapos@gmail.com, and let's learn together. Disclaimer: the instructional tool is created to enable students to develop their test-taking skills. The question or questions and answers contained in this instructional video were patterned after the official publicly accessed samples from the RN test plan of the National Council of State Boards of Nursing, or NCSBN. The discussions and rationale presented in the video are based on the lecturer's research and are meant to provide an explanation for the answer or answers to the question or questions that is or are presented. The lecturer makes no claim, directly, implied, or otherwise, that the rationale discussed is officially endorsed by NCSBN.